Welcome to day 2 of Healthy Economy, Building Africa's Public Health Sector. My name is Shone Shokobi, and if you are joining us for the first time today, I am the founder and principal consultant of Karfi and the Karfi Foundation. I told you that I was going to introduce the concept of sustainable healthcare economics. So I'll be bringing this in bit by bit as we speak with our guest speakers tomorrow and also with Bo on the last day. This is just a brief rundown again of our agenda so that you know it is a 4-day event. Yesterday's question was, what is healthcare and what is it like across the globe? Treatment is when we figure out what the problem is through the diagnostic care, and now we want to administer something to alleviate the illness or the injury or harm done to the body or the soul emotionally. And lastly, we need a way to pay for all of this. So insurance is a critical component of building a comprehensive healthcare sector. So China in general, just for starters, has seen healthcare as a new way to exercise political dominance. So just in big letters, if it wasn't clear already, COVID-19 has really shown us in this area that Africa must go back to the basics. And what I mean by that is we need to go back to figuring out, like all these other countries have independently on their own, to figure out how to get essentials like, again, access to running water, access to adequate medical care on our own and by our own means versus looking to others to do it. But because of the urgency of the current pandemic and the current crisis that we're going to be facing economically across the board, we need to figure out how to do it in innovative and accelerated ways.
My name is Patience Stevens, and I have recently retired from the United Nations after working there for a few decades, most recently as a special advisor, director and special advisor on education. Prior to that, I was the director of Intergovernmental Support Division of UN Women. And before that, I had done many years, 7 years altogether at the World Bank, working in the areas of population health, education, and also served as a demographer at the World Bank. But in addition to that, there are certain circumstances that make Africa particularly vulnerable, particularly important as a subject of the discussion that Karfi has initiated.
Hello, everyone. My name is Natasha Books, and I'm honored to be working with the Karfi Foundation on this very timely endeavor, given the public health crisis we're all facing globally. I'd like to talk to you today about global health diplomacy and entrepreneurship in the context of a healthy economy and African public health sectors.
Yeah, thank you for inviting me, and I'm honored to participate in this big 4-day event. Things that are happening here. The last 12 years, I've been managing a business for about half of it, and the last half I've been involved in venture capital and angel investing. One thing that is interesting, maybe to sketch, is that a lot of the venture businesses that I have looked at, and I've looked at hundreds of businesses and only funded about 12 or 15 in the past couple of years. I essentially meet all the most innovative and entrepreneurial people around and hear about their ideas. If we don't fund them, it doesn't mean it's a bad idea per se. It just can also mean that it's not exactly meets our particular requirements. If we look specifically at ventures in health, the one kind of a nice example that I wanted to give here today is a company called Access Afia. What metrics do you use to assess founding teams? Which is obviously something that we could talk about for a long time.
Now, as I wrap up this presentation, I just want to emphasize that my vision is that in order to build the public health system in Africa, we've got to try and exemplify the Karfi principle of iron sharpens iron. That's why I had that title at the beginning. One person sharpens another. So each of us will have a role to play.